Okay, so hello guys, welcome to our presentations. And today we're going to present about the hypertension disease. But first of all, let us thank to our professor or Professor Oriel to let us created these presentations and present to you guys today. Okay, so this presentation was created by Justin and Jeraya as a part of a group from the exercise prescription subject. Okay, so let's start. What is hypertension? Okay, so actually, various scientists or many scientists have defined hypertension in many different ways. But here is simple definitions of to what is hypertension actually. So actually, hypertension or the high blood pressures is when your blood pressures or the force of your blood pushing against the walls of your blood vessels is consistently too high. Uh, we can simply put hypertension as the common disorder in which blood pressure remains abnormally high. Okay, so now we're going to talk about how your blood pressure system works in your body. So your tissues and your organs need the oxygenated blood that your circulatory system carries across the body in order your body to function and operate properly. As your heart beat, it causes the pressures that forces blood into a tube-shaped network of blood vessels, such as lungs, veins, and capillaries. These pressures is the product of the two products of the blood pressures. The first one is the systolic pressures, and the second one is the diastolic pressures. So, when your heart beat, the pressures on the walls of your arteries is called the systolic pressures. And when your heart relaxes between each beat, the pressures on your artery walls is called the diastolic blood pressures. While your blood pressures may change throughout the day or the whole day, it should be less than 120 mercury for your systolic pressures and less than 80 mercury for your diastolic pressures. We're going to see why these numbers is really important for you. Okay, so many scientists and many doctors now they mark hypertension as a silent killer. But why? Because in many and various cases, hypertension has no obvious symptoms to indicate that something is wrong in your body. So that's why the best way for you to care and to protect yourself is for you need to being aware of the risk and making changes that matter to your health. Do you know that globally only one of every 7 people has their hypertension under control? So this type of disease that has no symptoms, it's really dangerous because the people that they have the disease, they don't realize that they have this disease. That's why until it's become really severe and they know when it's become really severe. And this is what do you need to be aware of when you have the hypertension. Okay, so many people with high blood pressures, they don't know that they have it. Often the signs or the symptoms of this hypertension are misunderstood. And the second one, the high blood pressures develop slowly over the time and can be related to many causes. As we know, the high blood pressures of the hypertension is one of the chronic disease that really affecting the mortality in this world. And the third one is the high blood pressures cannot be cured. But don't worry that high blood pressures or hypertensions, it can be managed effectively through the lifestyle changes and when it needed, the medications. Okay, so now we're going to talk about how you how do you need to understand your blood pressure's reading, or how important is it for you to understand the blood pressure reading. Okay, so do you only know that if you have the high blood pressures or hypertensions is to have your blood pressure tested, and understanding your result is a key or is a really important aspect to control your high blood pressures. Here we have a graph about the categories of the hypertensions as recommended by the American Heart Associations. So here we have the high blood pressures category. There are 5 of them: the normal, the elevated, the high blood pressures or the hypertension stage 1, the hypertension stage 2, and the hypertensive crisis. Okay, so here we have the systolic mercury numbers that the previous 2 slides ago I was talking about. And we have here the diastolic uh, numbers. So for the normal one, normal blood pressures, it should be less than 120 mercury for the systolic blood pressures and less than 80 for 80 mercury for the diastolic blood pressures. And the high blood pressures or the hypertension, it can be started when your systolic blood pressures is around 130 until 140 systolic blood pressures, and 80 until 90 for mercury for your diastolic blood pressures. And until the 5th one, we have the hypertensive crisis, which is you need to consult your doctor immediately, because otherwise when it becomes really severe, you never know that these hypertensions could be as a complicated to another disease, you know. So for this hypertensive crisis, the numbers is higher than 180 mercuries for your systolic blood pressures and higher than 120 for your diastolic blood pressures. But take into account that the high blood pressures or hypertensions should be diagnosed by the doctor, okay, based on the average of 2 or more reading taken after your initial screening. So you cannot diagnose the patients or the people just by checking them once. And especially if you just check once and not checked by the doctor or by the professionals. So these aspects you need to take into considerations. Okay, so now we're going to talk about the factors that affect the pressures on the arteries. I don't know if you guys can see the word of the arteries. I think okay, now you can see it. The factors that affect the pressures on the artery walls. Okay, so the first factors that affect the pressures on the artery walls, we have the cardiac output. And what is the cardiac output actually? Cardiac output is the amount of blood your ventricles push out of your heart each minute. Your blood pressure goes up as your cardiac output increases. And then the second one, we have the blood volume, or the total amount of blood in your body. BP or your blood pressure goes up as your blood volume increases also. And the third one, we have the resistance. Okay, so what is resistance actually? Resistance is anything working against your blood flow through your arteries, and several factors that contribute resistance, such as the flexibility of the artery walls, artery diameters or your diameter of your artery, and also blood viscosity or your blood thickness. Okay, so first we're going to talk about the flexibility of the artery walls. Why it is considered as the one factors that contribute with the resistance. Okay, so flexibility of the artery walls, eh, when your healthy arteries expand, your healthy arteries they expand with each heartbeat to help reduce the blood pressures on the arteries wall. And then the second one we have the diameter of your artery. Your body is able to increase the diameter of your arteries in order to your body to lower your blood pressures or reduce the diameter of the arteries to increase the blood pressures. And then the third one, we have the blood viscosity or the thickness of the blood. In the blood, particles such as the proteins and fats, they increase the thickness of your blood. And why? If your blood is thick, imagine if your blood is thick, automatically your blood pressures is increases. Why? Because your heart works harder in order to push the blood through the arteries. Okay, see, so here we have the pictures of the heart with the no hypertensions and with the hypertensions. With the no hypertensions, your heart pumping normally as usual, as the blood flows easily goes through the each vessels through your ventricles. And while you have the hypertensions, your heart pumping harder because it hardens your to for the blood to get through the heart. That's why the blood may not flow easily through the your vessels. Okay, guys, so now we're talking about the epidemiology or the perseverance or the how this disease separates. Here we took an example of how these hypertensions, uh, prevalence of hypertensions in the United States. So in 2017, the American College of Cardiology and also the American Heart Associations or AHA published new research about the prevalence of high blood pressures or hypertensions in United States. Okay, so in 2017, nearly half a million deaths in the United States caused by the hypertensions or the high blood pressures. Also, nearly half of adults in the United States, or it's around 108 million people, or around 45%, they have the hypertensions. Also, half of adults with the blood pressures over 140 for the systolic pressures and 90 for diastolic pressures mercury, who should be taking medications to control their blood pressures, but they were not taking the medications. Okay, so high blood pressures or hypertension was the primary contributing cause of mortality, that in 2017 in the United States. And because of this, high blood pressures or the hypertensions, it cost the United States about $131 billion each year, average over 12 years from 2003 until 2014. Okay, so when we're talking about these people that they died, half of the million in United States, more than 472,000 people died in United States, is we can count around 1,300 people died every day. Okay, within the United States, or we're going to talk about globally now. Okay, from this globally epidemiology, we could found the higher mean or higher average of the high blood pressures, both in systolic blood pressures and also the diastolic blood pressures in both men and the women were higher, found in the South Asia, Sub-Saharan Africa, and Central and Eastern Europe, where the lower mean blood pressures were found in the high income country rather than compared to the low income country for both men and women. Okay, so now we're going to talk about rates of hypertension controlled by vary by sex and race in the United States. Okay, so uncontrolled high blood pressures is common, but however, a certain group of people are more likely to have control over their high blood pressures than others. Okay, so here with the table, we can see a greater percentage of men, which is 47%, uh, have a high blood pressure than a woman, 43%. I couldn't find the same exact table from the research paper that I took, but I found this hypertension's prevalence by sex and race. Also, the high blood pressures is more common in non-Hispanic black adults, with 54%, than in non-Hispanic white adults, which is 46%. Non-Hispanic Asian adult around 39%, or Hispanic adults around 36%. Among those recommended to take blood pressures medications, blood pressure control is higher among the non-Hispanic white adults with the 32% than in non-Hispanic black adults with 25%. Also, the non-Hispanic Asian adults with 19% or non-Hispanic adults with 25%. Okay, so the table here, we provide the comparisons between those four race or ethnicity. Okay guys, so now we're going to talk about the types of hypertensions. So there are two types of hypertensions, the primary hypertensions and the secondary hypertensions. Okay, so the primary hypertensions, also known as the essential hypertensions. If you are measuring your hypertension within 6 months and you have your results and the results is stable, that's known as your essential hypertensions. Okay, most common these primary hypertensions or the essential hypertensions is occurring about 90 until 95% of the hypertension cases. But it's also unknown cause. But many associated factors such as the genetic factors and also the environmental factors. And now we're going to talk about the secondary hypertensions or another medical conditions that causes high blood pressures, usually occurring in the kidneys, arteries, heart, and endocrine systems. For example, the sleep problems like the sleep apnea, also blocked renal arteries in the kidneys, and also the last one is the unusual levels of hormones for controlling the blood pressures.
Okay, so we are going to look at the signs and symptoms of hypertension. Despite the potential to cause dangerous complication, high blood pressure often goes unrecognized as because we don't exactly feel the kinds of symptoms when we tend to get hypertension, and so we don't tend to know that we have hypertension until unless we get ourselves checked up by the doctor. So it does not usually cause obvious symptoms, as I said, making regular checkups essential. But these there are some symptoms which we start to get, we start to tend to get when our high blood pressure increases, when it increases really high. So when the blood pressure rises extremely high, systolic pressure of 180 mmHg or above, or the diastolic pressure of 110 mmHg or above, when it goes, so that's when we tend to cause the hypertensive emergency and certain symptoms, which will be like severe headache, anxiety, shortness of breath, nose bleeding, and stuff. So these are the symptoms when we really go above our blood pressure levels really high. So as we see in this picture, it's sure it's telling us more about the different kinds of symptoms, such as blue tint to the lips or our skin, tiredness, feeling dizzy or fainting. That's when our blood pressure really goes high, and we could feel it then. The shortness of breath during normal activity, chest pain, fast heartbeat, swelling of the abdomen, swelling of the legs and ankles. So these are such things. Okay, the risk factors for hypertension. All body pressure guidelines agree that support for behavior change to address modifiable risk factors should be the first step to preventing high blood pressure. So, so there are some things that we cannot change when we have this disease, when we have this problem. So it's age, anxiety, genetics, gender. So these things we just cannot change. Some things are we already have them, and the modifiable change that we can do to get our blood pressure into a normal stage, or to get rid of it, can be no excesses of sodium intake, obesity, poor diet, lack of physical activity, alcohol consumption, socioeconomic status, mental health stress. So these are the things that we have to avoid to have a better lifestyle, to have a better life. Okay, so I'll be speaking about the complications after having hypertension, the main causes, complications that will be occurring after uh, hypertension. So the main ones are like brain stroke, eye loss, when we lose our vision, heart failure, heart attack, sexual dysfunctions, heart, kidney disease, failure, and stuff. I'll be explaining you all more on each of these topics in the further slides. Okay, so we see this, we see the consequences in a more expanded way. So the high blood pressure causes a several vessel related complication if not properly controlled. So if we don't take proper precautions, we might face a lot of vessel related complications, such in our hearts and the blood vessels and stuff. And so it even it even narrows and lessens the flexible of the vessels, causes of atherosclerosis. I'll be explaining you more on this specific term in my slides later. Okay, so the next point, if the arotho details. So what is arotho? What is arotho in terms of this word? So it is mainly the largest anterior in the human body. Uh, yeah, sorry, it's the largest artery in the body. Sorry, it's the largest artery in the human body, originated from the left ventricle of the heart and extended down towards the abdomen of our body. And the dilates, the word means is widening of the artery, which these are the causes which is happening after the hypertension. Okay, so it can cause an aortic aneurysm, which is it is an enlargement of the aorta to generally be expanded more than 1.5 times of a normal size of the artery, which is which expands, or 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 the aortic dissection. Okay, so this is more, it causes when the inner layer of the artery starts to the blood flow between the layers of the artery facing like it starts to affect the inside arteries, and so the affects the inside arteries. Okay, if coronary arteries are suddenly blocked or narrowed, angina results. Okay, so this is the causes which happens when after hypertension. Okay, heart failure occurs when the function of the heart deteriorates. When our heart starts to fail, we have heart attack and stuff. Then the next is the stroke or even vascular dimen- dementia are caused by cerebral vascular in is isch- ischemia. I'm really sorry for my pronunciation of these words, really hard. Okay, so what is this ischemia? Is the less amount of blood flow to the brain, or even less amount of oxygen uh, when it's going to the brain. So this is then that's when we have a tendency of getting a brain stroke. And then we see the kidney disease or failure is the functions which when the kidney starts to deteriorate, it can lead to a chronic kidney disease. It can lead to a chronic disease. More okay. Next, so moreover, you can lose your way. You can use your eyesight from retinopathic disease. Is when our retina starts to the eyesight starts to decrease, and when the retina starts to get affected and we are not able to see. And then the next one and the last one is the sexual dysfunctions. When our sexual organs system starts to not function, it stops functioning. Okay. Okay, as I told, I'll be explaining the atherosclerosis term more in detail. Is So this is like one of the main causes that happens. It's like a disease where the artery wall thickens up. It starts to thicken up, and then where it the fat and the cholesterol starts to form up from inside, even from outside, and stops the supply of the blood going through. And this is when we start to get all those problems like brain stroke, the kidney problem, the sexual problem, the sexual thing, uh, sexual problems and stuff. So it's this disease can even cause a cerebral hemorrhage, cerebral cerebral inch ischemia, like the diseases, the vascular dementia, and stuffs, which I just told you. So these are the problems that we could face. Okay, another part, the complications. Okay, hypertension causes severe problems within the blood vessels. When the blood pressure spikes, it damages the vessel walls, and which leads to a wall thickening and the fat accumulation, as I told you earlier. This leads to angina, myocardial infarction, heart failure, kidney failure by decreasing the blood flow of the heart, brain, kidney, and extremities. So these are the problems we start to face when after hypertension, when we are not taking care of ourselves properly. Okay, so here we see is the amount of the systolic blood pressure and the diastolic blood pressure, that how much is increased. So these causes are one of the most so cardiovascular disease is one of the most common problems that we face after this. Is the mortality rate for the cardiovascular diseases increases as the blood pressure rises. That's what I said. And the mortality rate from cardiovascular diseases increase as blood pressure rises. So as we see in this research paper over here, as it's showing this graph over here, is that when we have our SBP, which is the systolic blood pressure, and the DBP, the diastolic blood pressure, is when it is 115 by 75, it's normal. But when it increases to two times more, to 135, 85, that's when the risk of our cardiovascular, for us to get the cardiovascular disease increases. So the graphic below shows us the pressure which increases of 155 by 95, which is increased by 4 times. It results in a risk of death from heart diseases. So it's more of those chances. And even 8 times more to 175 by 105, that's when the risk is really high. But then I could not get the other part of the graph, which is the 16 times more, which is 195 and 115. That's really huge, and it's not at all normal. That's when we that's when we that's when we tend to have a heart disease, or we could die with that. Okay, next. So the importance of blood pressure control. What are the importance of blood pressure control? So it's complicated prevention. By controlling blood pressure, we could cut the risk of getting hypertension and our blood pressure going up. So it's like we could cut the risk of even getting a stroke by 30%, myocardial infarction by 25%, or a chronic kidney disease by 23%. So if we try to keep our blood pressure under control, we would reduce the risk of getting all these kinds of diseases, which will not help us in recovering and being a better, means being good or better human in our bodies. I hope you get me. Okay, so patients with hypertension often skip their medication on regular checkups, because we always because there's no like something, we don't feel something in our body, and then we tend to think that we are fine and we are okay, but that's not it. Inside, it's all the problems are all happening. So that's when the hypertension is that's when we start to neglect hypertension and think that we are fine. So it can lead to a more severe disease or complications such as stroke, myocardial infarction, and chronic kidney disease, as I told you earlier. It continues the blood pressure control in recommended to prevent these complications. So if we take a control, I'll explain you more on little numbers, that how we have to know that we are in control or not. So if we take care of ourselves, so we would not have these complications. Okay, the treatments, the kinds of medication that we should take as in precautions for our health. So treatment and medication is recommended for lower blood pressure, less than 130 by 80, in people older than the age of 65, and those risk factors such as the diabetes and high cholesterol. So if we have a weight loss, and avoid coffee, even exercise. But I'll explain you more on these. So these treatments can can reduce our chances of getting our high blood pressure, uh, 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 reduce the reduce to get high blood pressure. So weight loss, one of the most efficient lifestyle changes for controlling blood pressure. Losing even a small amount of weight, if we are overweight or obese, can help us to reduce our blood pressure. Avoiding coffee, because it has caffeine in it. Caffeine can raise the blood pressure up to 10 mm. Hedgy is hedgy in people who really consume it, because that's when we tend to increase our blood pressure. And exercise, if we start exercising, will help us to keep our blood pressure under control. Okay, so these are like these are some kinds of drugs which doctors mostly recommend for the patients. And so these are the thiazine, diuretic, antiogenic, converting enzymes. The second one, angiogenesis second receptor blockers, calciums and channel blockers. So these are different kinds of drugs which will help to relax our muscles and the body vessels. Even these act like for our kidney to help the body eliminate sodium in water and stuff. So these are the main things which a doctor might recommend. Okay, so here we come on to fighting back against hypertension. Okay, how are we going to prevent ourselves for getting high blood pressure? Okay, while there is no cure, using medication as prescribed and making lifestyle changes can enhance our quality of life and reduce your risk of heart disease, stroke, kidney disease, and more. If you see, actually, there is no exact cure for this disease, but it's there are chances that we can reduce the risk of getting different kinds of disease and problems by taking a control over our diet, our exercise, our daily life routine, which I'll be explaining you more in the further slides. So being inactive is bad for your health, as we all know that. And if we even if we just keep walking around, or doing some kind of small activities, even in our daily life, in our house itself, would help us to reduce these different kinds of disease factors. So let's see, people who ain't physically active are much more likely to have healthy problems like heart attack and stroke. On the other hand, regular physical activity helps us to lower the blood pressure, control weight, and reduce stress. So these are the main factors that we have to get into control to not have a high blood pressure. So as I told you, I would be talking about some figures which will help us to uh, to know that when we are having a high blood pressure or not. So we can see over here, when it's normal, we have 120 to 80, 120 to 80, or lesser. And then when we increase to 120, 139, we have a hypertension. And then when we have high blood pressure, and the high more blood, like we increase, and then hypertension crisis more, when we increase more, is by the stages. So we have, after we cross a hypertension, we have hypertension 1, and then hypertension 2, and the hypertension, and then the emergency stage 2, which is the highest, and that's when we could have any kind of disease or failure of our body parts. And so these are the numbers that we have to check, while we are checking our blood pressure at home. So if you are diagnosed with high blood pressure, you should monitor your blood pressure regularly. We should regularly go to a doctor to check up our blood pressure, or else we could check it up at home itself by our own selves. Maintaining an awareness of your number can alert you to any changes and help you detect patterns. Tracking your results over time will also reveal if the changes you have made are working. So we could see that if our blood pressure is going high, or is it low, or is it moderate, or how am I doing? And that's when we could apply more of taking care of ourselves and our diet and our physical activity and stuff. Okay, so here we see that what are the main things that we have to take care of ourselves. What do we have to take care of for not getting a high blood pressure? So while heart disease is is still one of the it's number one killer in the United States and around the world itself. So death rate have decreased significantly. Earlier and better treatments of high blood pressure has played a key role in this disease. So we see that some so we see that there are a lot of things which we have to do to be under control. And so let's look at it. Let's look at these points over here, that these are the main points which will help us not to get a high blood pressure. So so the so so the some ways are like to eat well, balanced diet, that low in salt. We should not take salt more than, I think, 1500 mg per day. Salt. Limit of alcohol, drinking a lot of water, enjoy a regular physical activity, manage our stress levels, maintain healthy weight, quit smoking, take our medications properly on time, work together with our doctors, and not disobeying. So these are the main factors that would help us to have a balanced and a healthy lifestyle.
Okay, so now we're going to talk about the relationships about the physical exercise and hypertensions. Physical activity and physical exercise actually can prevent hypertensions and decrease their levels for the people that already have the hypertensions or the hypertensive people. Okay, so physical activity and hypertensions. Actually, exercise is a key component of lifestyle therapy for the primary preventions or how you prevent uh, hypertensions. Is actually based on your habit or your lifestyle. And actually, this is the first treatment of your hypertension. There are many studies, many numbers of studies that consistently demonstrate the benefits, effects of exercise on hypertension, with the reductions in both your systolic pressures and also your diastolic pressures, as much as the 5 until 7 mercury reductions in those with the hypertensions. Here we have the table about the studies investigating the influence of physical activity on the hypertensive heart. So for the people that already have the hypertensions, how the physical activity contribute. And among all of these studies, actually the results among all of them is significant decrease in the high blood pressures. So if you are curious, you can read one of these articles that really shows that how physical activity uh, contribute in decreasing your hypertension or your high blood pressures. Okay, so we're going to talk about the benefits of the physical activity. Okay, so physical activity not only helps to control your high blood pressures or your hypertensions, but it also helps you to manage your weight and control your body mass index and strengthen your heart and lower your stress level or your mental health. A healthy weight and also a proper body mass index A strong heart and general emotional health are all good for your blood pressures. Okay, so here we have the example, 5 examples of the benefits of physical activity for the hypertension people. So the first one is to achieve the normal blood pressures. And then the second one, we have the to increase the sodium eliminations in your body. The third one, we have the reduce contributions of hypertension to cardiovascular risk. The fourth, the fourth one, we have the mental health and the social well-being. And the fifth one, we have to reduce the visceral fat or the fat that's stored in the organs. Okay, so by adopting this healthy lifestyle, you can reduce the first one, reduce the high blood pressures, prevent or delay the development of the high blood pressures, and also enhance the effectiveness of the high blood pressures medications if you are already a patient of the hypertension. And also it really lower the risk of the associated causes or associated uh, disease that will come if you have the hypertension, such as the heart attack, the stroke, the heart failure, also the kidney damage, the vision loss, and also the sexual dysfunctions. Okay, so now we're going to talk about the exercise prescriptions for those who have the hypertensions or the high blood pressures. Okay, so the first one is the aerobic exercise, or include the large muscle activities on the body, such as the running, walking, cycling, and also swimming. Why we don't do the anaerobic exercise too often or the higher intensity is because when we're doing the anaerobic exercise, our body demands a lot of oxygens and a lot of uh, increase in our high blood pressures. That's why it's dangerous if we're really increasing our blood pressures and also our heartbeat. Because if it's too high, uh, we're going to have many kind of problems afterwards or concurrent with the exercise. And also the second one, we have the resistance exercise or the multi-joint exercise, better rather than the single joint exercise. Also progressive exercise and the large that includes the large muscle groups of the body, such as the chest press, squats, and lunges. And the third one, we have the flexibility exercise that helps to improve the ROM of range of motions of your body to avoid injuries and also help to maintain your balance. For example, we have here the hamstring stretch, the quadriceps stretch, the hip flexor stretch, and many more actually. Okay, so still with the exercise prescriptions. So if you want to have the further informations about the exercise prescription for the hypertension people, here you have the ACM SMs or the American College of Sport Medicines, then the guidelines for the exercise testing and prescriptions. Okay, so according to the FITT recommendations for individuals that have the hypertension, for the frequency for the exercise, the recommendations is you're doing the aerobic exercise almost and preferably all days of the week. Uh, and for the resistance exercise, 2 until 3 times per week. Okay, so let's talk about the intensity of the exercise. For the aerobic exercise, the recommendations is the moderate intensity or 40% or less than 60% of your VO2 reserves or your heart rate reserves, or the RPE between 11 until 13 on the Borg scale or 6 until 20 scale. And then help or supplement it, or and also you adjust your resistance training between the 60% or 80% of your one repetitions maximum. Okay, so what's the time or the volume of the exercise? Okay, so we have here the 30 until 60 minutes per day of continuous or intermittent aerobic exercise. If it's intermittent exercise, use a minimum of 10 minutes bout accumulated to total 30 or 60 minutes. So you're working each 10 minutes of workload and then have a bout of 10 minutes and then continue to exercise. And then for the second one, the resistance training should consist of at least this one set of 8 until 12 repetitions for each major muscle groups. Okay, so the type of exercise, here we have the emphasis should be placed on aerobic activities such as walking, jogging, cycling, and swimming, as we talked in the previous slides. And also for the resistance training, use either machine weight or free weights may supplement the aerobic training.
Okay, so let's look at the contradiction exercises, the exercises that we should not be doing as a hypertension patient. So the different kinds of exercises can have different kinds of effects on our body, and certain activities should be avoided. These kinds of activities should be avoided for if we have high blood pressure. We know heavy lifting, weightlifting, or heavy lifting weights, even above our shoulders, is bad for us. Even playing squash, skydiving, sprinting, scuba diving. So these activities have much more high intensity in them, and that's what affects, even for example, if we are working out and if we are talking at a moderate pace when while we're talking, is fine enough. But if we start singing, for an hypertension patient, he might start getting a very high fast heartbeat, and he might feel that, and because there'll be a lot of pressure on him while doing all that. So um, so there could be some exercises which could be certified by the doctor that he or she could do it according to their kind of hypertension or their situation. Okay, so how can we improve afterwards, after this hypertension? So as I had talked earlier, uh, we could so as I talked earlier regarding these things, so we could control our blood glucose level through medical treatment, regular physical activity, eating healthy. So these are the main things. We have to have a physical activity on a regular basis, eating healthy every day, every single meal of yours. It's very important to keep your blood pressure rate or level at a good number. If you have hypertension or dis, disciplinea, control these as well. So we have to take control of all these things while we are having this problem. Although you may not have any complication, we don't feel anything, yeah, yet remember to get a regular checkup. a regular checkup by the doctor, our blood pressure level, cholesterol, and stuff. At least once every, like at least once every 1 to 2 years, or even we could check up now by the by the by the by the new technologies which are there at home itself. And as we see, the next one is the one which I had talked earlier, managing a stress level, eating healthy, quitting smoking, stop stop intaking of alcohol and stuff, and doing a physical activity um, on a regular basis.